The late Professor Barry Commoner had a quote that has always stuck with me, and that was that environmental pollution is an incurable disease. It can only be prevented. And that really resonated with me the first time I heard that. Let me mention it again. Environmental pollution is an incurable disease. It can only be prevented. And this is so true. When we look at air pollution in this country and throughout the world, we can see the true harmful, long-lasting effects. Take this pandemic, for example, and looking at air pollution as being a predetermining factor in terms of severity outcomes. They did a study early on in the pandemic where they recognize that people in the regions in Italy that had the poorest air quality did much worse in terms of their exposure to COVID-19. And atmospheric pollution is driving poor health outcomes. So in that particular study, it made me go back and think about that quote. And understanding that if we do nothing for the just enormous amount of air pollution that we are exposed to every single day, and we are not taking precautionary measures ourselves in terms of trying to get the right nutrients in every day, trying to live as healthy of a lifestyle as we possibly can, then we're in a lot of trouble. And I want to talk about that in some detail today, because especially in places like New York City, where we know air pollution is certainly linked to so many different chronic diseases and the exponential amount of people who have succumbed every year to, directly to air pollution is really very alarming. And, every single year they publish their findings, how many people this year in New York City perished directly due to air pollution. And, it's usually somewhere around 3,000 deaths per year that they can contribute directly to air pollution. And you may think, oh, that's not that many. Well, that certainly is. 3,000 New Yorkers on an annual basis where they can directly correlate air pollution as a cause of death. That's a major problem. And I know that there's a lot of different regulations and clean air laws that have really improved the air quality within places such as New York City. However, is it enough, and is it happening fast enough? And that's always the question. And so we clearly know the answer to that is no, we're still exposed to high levels of air pollution, and we need to be aware of things that we can be doing. So I want to talk about some of the science behind that today. So I'm Amanda Williams, MD, MPH, and as I mentioned, every year, air pollution and the health of New Yorkers, there is a annual publication where they go through and they talk about the different particulate matters and the health impacts to those particulate matters. And they track, how many hospital admissions due to respiratory disease, due to cardiovascular disease, exacerbation of asthma in emergency rooms. And I think the one area that really catches a lot of people's eyes is when they realize the impact of air pollution on the heart. And researchers at Columbia University, the Mailman School of Public Health, they really did some interesting epigenomic work where they were able to look at the true impact of air pollution on the cardiovascular system. And one area that was really quite intriguing from all of that research was B vitamins. So just B vitamins. And finding that people in New York City who had more cardiovascular disease brought on, secondarily due to air pollution, had low B vitamin status in the body. And that just supplementing with B vitamins, getting those crucial B vitamins back on board, could be critical in reducing the impact of air pollution. Something as simple as B vitamins. And I think that we need to recognize why we have different nutrients in our body and the role that those nutrients are playing. So I want to talk about a journal that came out in 2017. This was in the Scientific Reports Nature Research Journal, talking about B vitamin supplementation and how that can mitigate the effects. So we're talking mitigate, we're talking about minimizing or diminishing the effects of fine particles on cardiac dysfunction and inflammation. So they talked about all these ambient fine particles, the air pollution. Remember, we don't see it, we don't smell it. Sometimes you can be driving and you can see a factory and you say, okay, that clearly can't be good. But for the most part, we don't see this. But yet we breathe it in every single day. So obviously we would think, yes, respiratory is going to be one primary factor. I just gave you the example of the area in Italy where air pollution was higher and the rate of COVID severe cases was higher. So we know that there's a direct link with the respiratory system and when we're breathing in those harmful particles each and every single day. But now being able to recognize that this can trigger acute cardiovascular events and it can create significant endothelial dysfunction and inflammation. So they wanted to see if we give folks B vitamins, will this do anything? And so they were testing their B vitamin levels. They were looking at their folic acid, their B6, their B12 levels, and correlating that with coronary artery disease, with congestive heart failure, with overall cardiovascular disease. And realizing that recent studies had suggested that B vitamins could minimize the health effects of environmental stressors through their anti-inflammatory and antioxidant properties. Yes, think about that. B vitamins working as a role as antioxidant and anti-inflammatory. We never think about our B vitamins in that setting. And they said we are seeing that B vitamin supplementation has been successfully used to curb oxidative stress, inflammation, and metabolic changes that have been brought on from environmental stressors, including air pollution. So in just giving people B vitamins, they saw this significant shift in cardiovascular functionality. And the World Health Organization, I don't want to just pick on New York City. I mean, clearly whenever we look at large cities, we know that there's going to be a higher amount of air pollution. But the World Health Organization estimates that 92% of the world's population currently lives in places where air quality levels exceed the limits for what is considered to be okay. Meaning that 92% of people in this world every single day are breathing in air that contains higher than acceptable levels of these contaminants, these air pollutants that get deposited into the respiratory tract, that can affect overall systemic inflammation, that drive up oxidative stress, that can affect the heart. And understanding that taking a blend of just folic acid, B6, and B12 could make a significant difference. This particular study that was done out of Colombia was funded through the National Institute of Health. And seeing that the development of a standard care, treatment, using B vitamins to offset the effects of air pollution is really quite remarkable. But yet we usually don't hear about this. I mean, most people in New York probably have no idea, like, oh, I should be taking B vitamins because I live in a very highly polluted area, which is said true for 90% of the world's population should be taking B vitamins because it can help to offset, because it has that antioxidant property, because it has the ability to target the inflammation that is brought on from these harmful chemicals that we are breathing in each and every single day. And you think, well, how am I exposed to so many? It's not just factories, the cars, the buses, the pesticides that then get circulated throughout the air that we breathe. Indiana University did a absolutely amazing, but yet incredibly alarming study where they assessed the levels of a very well-known herbicide in pregnant women. So they were looking at glyphosate. And you may think, I think I've heard of glyphosate. Yes, that is what the active ingredient in Roundup is. So Roundup, what people use to spray weeds. Researchers at Indiana University, along with the University of California, San Francisco, reported that glyphosate levels correlated significantly with shortened pregnancy lengths. So what does that really mean? They said there's growing evidence that this exposure to this Roundup, this glyphosate, this very harmful pesticide, that this could reduce gestational length, which could then have lifelong adverse consequences to the offspring. So they wanted to look and see. So they took a group of women who were pregnant and they did urine samples to detect the level of glyphosate. 93% of those pregnant women that they tested had detectable levels of glyphosate in their urine. And what's interesting with this is they found that the women who lived in rural areas had the highest levels. So, and that makes sense. One would think that in an area where there's more open space or farming, that you would be using more of this herbicide. But that's what we have to think about. These women have high levels of this that they've already been able to detect and say, hey, because you have this could actually, you could have preterm birth, which can then impact the life of that child because they didn't develop properly. There was another study out of Cornell University looking at pesticides lurking in homes in New York. And they said, despite the existence of chemical-free methods to eradicate pests, Americans use more than 1 billion pounds of pesticides each year. And due to that, they wanted to look and see, can we find this in homes? And if we do, then we know people are breathing this in. So they sampled 350 homes throughout New York, the state of New York, looking for 15 different toxic pesticides, ones that they know are commonly used in that area. So maybe they have a golf course over here and we know that they use Roundup, and this area over here is a farming community and they use the X, Y, and Z pesticides. But they found that pesticide residues were ubiquitous in New York homes, especially rural homes. And they found positive results for these chemicals in every single house that they tested. 350 homes that they went into to look for these pesticides, and they found detectable levels in each of those homes. Why does that matter? Because we know numerous health problems occur because of this exposure. We know certain cancers, birth defects, the exacerbation of respiratory conditions, cardiac conditions. So if those pesticides are accumulating and circulating throughout the home, then that's an issue. Queen Mary University of London did a study a couple of years ago, and they said even low levels of air pollution is linked with serious changes within the heart. Serious changes within the heart. And they published this in the Circulation Journal. They looked at the data from over 4,000 participants in the UK Biobank study. And these folks had provided a whole range of different information, including their lifestyles, their health records, where they'd lived. And they had blood tests done. And they had MRIs done. What they found was a clear association between those who lived near loud, busy roads, who were exposed to higher amounts of air pollution, had a greater likelihood of having an enlargement of the heart, cardiac hypertrophy. Higher exposures of air pollutants were linked to more significant changes in the structure of the heart. And they were actually even able to narrow it down to the minimal amount of exposure to that air pollution. And they said the doctors and the general public need to be aware of this. We certainly know it's not just limited to the heart. We have seen that air pollution can be linked to heightened dementia risk. So one would think, yes, if we're breathing it in, it's not just affecting the lungs, it's not just affecting the heart, it's going to affect your brain as well. And this study, also done in the UK and published in the British Medical Journal, showing that air pollution was an established risk factor for not only heart disease and stroke and respiratory disease, but also plays a role in neurodegenerative diseases such as dementia. And so in this, they pooled data from over 130,000 people between the ages of 50 and 80 years old who had not been diagnosed with dementia. And what they did was they assessed where they lived, and then they tracked these people. And in doing such that, they once again were able to find that those living in areas that had the highest amount of air pollution had a 40% heightened risk of being diagnosed with dementia in the future. So air pollution is not something that we should mess around with. We have to be wise. So at minimum, taking Methyl B, which is the activated B vitamins from Invite Health, taking one of those per day, taking daily detox, whether you take the Detox HX tablets or you're taking the daily detox powder, we have to support our liver's ability to detoxify, and we have to make sure that we have adequate nutrients on board to ease inflammation, to target oxidative stress. All of this is so important for our overall longevity. So I want to thank you so much